Hello. I hope all of you are fine. Today, I'm gonna talk about one of the autoimmune diseases that is called multiple sclerosis. Let me share with you some slides that might help you understand it better, what I'm talking about. Okay. As I said before, autoimmune diseases are named after where they attack and how they attack. So, some autoimmune diseases are attacking only the brain and the spinal cord. One of those diseases is MS. So, there are other diseases that can attack brain and spinal cord, but one of the famous ones, which only attack brain and spinal cord, is MS. So if you look at here, this is the brain. This, like, think in the different color, it's a cerebellum, which is a part of the brain, mostly controlling our balance. And then the data coming from the brain out to our arms and legs are gonna come down through the spinal cord. First part of it is cervical spine, and then thoracic spine, and on the top of the lumbar spine part, the cord is going to be finishing. So central nervous system is composed of cells called neuron. There are some other cells that are supportive of neurons, and they mainly help them having food and having a better environment. But the main cells that are responsible for the nervous system actions are neurons or nerves. So if you look at here, the neurons are usually a very long cell. Some part of the central nervous system, they are smaller. Some part of it, it's longer, and some are very, very long. So this part of the part of the cell, it's the cell body, and then there are some extremities and extensions coming out of the cell bodies. One part which is closer to the cell body, usually it's called dendrites, and this is the axon. So from cell body to the other cell body, the information is usually transferred from the axon. So there is going to be an electricity generated or passed to from another neuron to this neuron, and that electricity is supposed to go out all the way through that neuron and then be transferred to the next cell. So there is a network of neurons, which is called neural network, and then the information is passed through each cell to the next cell. But because these cells are very long, the information has to pass through these axons or these extensions from the nerve cells. So the information is like a type of electric impulse. If the electric impulse want to go slowly here, it would take time a little bit more. And from the time that we decide to do something until we do it or we have a sensation is takes less than a second. One of the ways that body helps the neuron to work faster is to make them with a different type of cells, make a fat tissue, like a bit of fat tissue around these axons, which are called myelin. So this is a called myelin sheath, which is made from a different cell, which we are gonna talk about it later, around these axons. So when the electricity comes here before one of these myelin sheets, instead of going through the axon, it jumps from one myelin sheet to the other. So instead of going through, it can jump between myelin sheets. So it makes the information to be transferred much faster. So when we have MS, the part of our central nervous system that goes under the attack is this myelin sheaths. So when there is the damage to the myelin sheaths, there are two things happen. One is that the information although it's going to be processed and transferred, it's going to be much slower. So the transference of the information is much slower. And another thing that happens is that um, slowly these are kind of protecting the cells. There is a chance that these cells die after the myelin gets under attack. So eventually can cause these cells to die, but also even if the cell doesn't die, the transport of the information from one side to the other side is going to be much slower. So, um, so the lesions can be any part in our central nervous system, and they all, as I told you, they attack the myelin sheath. So this is the axon, and this is the myelin sheath that we saw on the other picture. The electricity is supposed to jump between one myelin sheath to the other, but when there is a damage to this myelin sheath, the axons gets exposed, and they can be affected and can get killed as well. So, generally, MS is much more common in women, about 3 times more common in women, and usually happens in the childbearing time. So, around the age of 20 to the age of around 50. So, there are MS development in childhood and MS development after the age of 50, but the chance of MS developing at this ages is lower. So about 5% they can happen in childhood, about 5 to 10% can happen when you're older, after the age of 50, 55. Women, like the chance of getting MS gets much less after they get menopause. The men who don't have a menopause, they have similar time of onset that after the age of around 50, 55, the age of the chance of getting MS becomes lower. It doesn't stop. We still get MS patient in these ages, but the chance is lower. So, and another thing is that there are lots of risk factor for MS. So, who gets MS? Uh, not everyone gets MS, we know that, but we see lots of people getting it. We might know people around us who have it. So there are different risk factors for MS. Some of the risk factors we can change, and some of the risk factors we cannot change. One of the important risk factors is genetic. So, genetic is an important thing, but it's not everything. So, imagine if you are a patient who have MS, there is a higher chance of your kids or your brothers and sisters and even your parents, like they would not, like your parents, the chance of developing it is probably lower because they passed the age, although it's not zero. But your siblings and your kids, they have a higher chance. But this higher chance doesn't mean that they're going to be absolutely developing MS. Why? Because when they saw the identical twins, the ones that they were sharing 100% of the genetic, if one of them develops MS, the other one only has about 25% chance of getting MS. So it's a very increased risk of MS in if you have an identical gene, but it's not 100%. So you are not even having 100% genes with your kids. So they get 50% of your genes. So the chance of them having MS definitely is higher than the normal population, but it's not an absolute risk. So if we can try to modulate the risks that it's in our control, hopefully we will hope that they don't develop MS in the future. So what are the other risk factors? So one of the important risk factors is smoking. Of course, like smoking causes lots of cancers. It has effects on heart attack, stroke, and lots of autoimmune diseases. I guess like all of the autoimmune diseases. One of the important ones is MS. So if you are smoking, there is a higher chance of you getting a MS. And if you have MS and you continue doing smoke, there is a higher chance that your disease stays active or even progress. So even if you are a person who got MS now, the best thing you can do for yourself and your smoking is to stop smoking. So another risk factor for developing MS is obesity. So both in it has been more shown in pediatric MS patients, but it can also be observed in the people who are adults. So we have seen that the people who are more obese, there is a higher chance of for them to get MS, and again, there is a higher chance of MS progression if they stay obese. So if you're like having a high weight and you just develop MS, try to lose weight. That would decrease your chance of MS progression. So these so far, the smoking and obesity are a little bit more in our hand. Another important factor is vitamin D deficiency. So vitamin D deficiency is a very important problem in nowadays. Lots of us are deficient in vitamin D. Some of it is because that we don't get enough sun, but lots of other problems is that because some of the people are just generally resistant in absorbing the vitamin D. And vitamin D is very important for our immune system and has been very specifically seen that MS patients have a lower vitamin D in general. And when they have a lower vitamin D and we don't treat it and do not make sure that our vitamin D is normal, they are gonna have a higher chance of MS relapses. And so if you're diagnosed with MS, I would say it's important to start vitamin D supplement. The number for the most of the labs as normal vitamin D is 30, but you should try to get yourself more higher, like around 50, 60, 70. Usually after between 80 to 100, it gets to the toxicity, but it's hard to get there. So I would say for lots of people, I cannot say for all of the people, but for most of the people, taking 4,000 to 5,000 of vitamin D daily can get them to the goal of not be vitamin D deficient and have a good level. But you can start taking vitamin D and then ask your neurologist or your primary care doctor to check the levels and adjust the amount of vitamin D you're taking based on the levels in response. Um, so, like again, you remember I told you that there are genetic, if you are like develop MS, there is a high chance for your kids or even your siblings to develop MS. So one of the things that you can do for them is telling them to start vitamin D. So try to give your kids vitamin D. Ask their pediatrician how much their vitamin D you can give them, or tell your siblings to make sure their vitamin Ds are good. Make sure that your kids don't get obese. Make sure that they are not exposed to smoking, and like hopefully ask, like kind of encourage them to not start smoking in the future. So another risk factor, which is a little bit out of our hand, is EBV infection. EBV or Epstein virus infection happens in a lot of us. It's a very common childhood infection, and lots of time when it happens in like when we are very young, it can be asymptomatic, but or with very mild symptoms, and it go away, and it might not be as much of a risk factor if you get it in when you're young, as much as you get it in when you're later, you're older. So when you get this ABV infection at an older age, usually your symptoms are worse, and there is a higher chance of getting autoimmunity with the EBV infection. It can always sometimes even cause like lymphoma type of malignancy too. So there are lots of scientists now trying to make EBV vaccination, but unfortunately, so far we don't have any good vaccines. But in the future, hopefully, if we get a vaccine, we can prevent this from happening. But until then, It's just that like if your kid gets it in a very young ages, it's not as much of a risk factors. Even in the old studies, they were saying it's a protective factor against getting an MS. But as your kids get to the adolescence or adulthood and get the EBV, that's when it causes higher number of autoimmune diseases like MS. So, what are the initial symptoms of MS? It varies from one person to another person. So it can be lots of symptoms. So I know like there are depression, anxiety. There are lots of people with depression, anxiety. We usually don't like diagnose people as a first attack with depression and anxiety. Lots of us have sleep problems. The things that are usually cause us to go and check for MS is that sudden onset of vision loss in one eye, that which is usually painful. Like usually the people who get like blurry vision in one eye, they get a pain when they move their eyes to side from side to side, but sometimes it doesn't happen. So if you have suddenly developed a vision loss changes, blurry vision in one eye, and you went to an ophthalmologist and they saw, okay, there is nothing else changed. First of all, like the first thing that has to come to your mind is that, oh, maybe my prescription is changing, unless that it's a severe change in your vision that you have to go right away to emergency room. But if like there is a little bit, first check with ophthalmologist, see if like the vision gets better by changing your glasses. If not, it's something that you should consider. There are other things like double vision, having vertigo, room spinning sensation, or something like feeling of unbalance. Some people might have a problem with talking, tremors sometimes, although lots of tremors are benign, but there could be problem with the MS and lots of other things. The common ones is the loss of vision in one eye, or sometimes both eyes, and having a weakness in one arm or leg or both of them, and having sensory symptoms like numbness, tingling, or even loss of sensation in arms or legs, or like even on your chest and trunk, or even around your waist. So having a sudden onset of numbness that doesn't go away after 24 hours. So that is another important thing that you have to consider for MS. Usually the symptoms that last like few minutes, few hours are not MS. There could be lots of different stuff. Usually, the symptoms of MS last more than 24 hours because from the time the inflammation starts, you get the symptoms, and inflammation resolves. It takes time. So it doesn't go away that fast. It takes time for it to go away. The other symptoms that are along with it is fatigue, being tired. You might feel more depressed or anxious. So there are lots of different symptoms, but the most common ones are loss of vision, having sensory symptoms like numbness or tingling or loss of sensation, and weakness in arms or legs. And sometimes having a balance problem or vertigo, room spinning. So when you have a room spinning sensation, it's most commonly come from ears, but sometimes it can come from the brain. So there are different phases of MS. So one of the phases that it's not MS, but it can be predictor of MS, it's called clinically isolated syndrome. When this happens is that you have an episode, a clinical episode, a problem, for example, a loss of vision that happened, and but you don't have any other symptoms. You never had any prior symptoms before, and when they get the MRI for you, they see that there is an inflammation in one space, but you don't have the criterias for develop for the MS diagnosis. The criterias for MS diagnosis, I'm gonna explain it in a different video, that how we can kind of diagnose MS. So in that situation, your doctor might call you clinically isolated syndrome. So generally, the people who have clinically isolated syndrome have close to 50% chance of developing MS or other autoimmune diseases that affect the brain and brainstem and spinal cord within the next 5 years. So if you are diagnosed with clinically isolated syndrome, your neurologist may have to start taking MRIs of your brain or sometimes spinal cord every year, at least to make sure that there is nothing new happening, and also like follow you clinically, sometimes do a physical exam and ask you to tell them if anything new happens. The other type of it is like one of them is which is most common in people is relapsing remitting, meaning that there is a new clinical problem because there is a new one or few focuses of inflammation in the brain which is causing your symptoms, and after a little while, like a month or couple of months, they go away, and you might get 100% back to normal or close to normal, or at least an considerable amount of improvement. So lots of time when this new attacks comes, your doctor would give you very high doses of steroid, usually IV, but it can be oral, but they're very high doses, so it's hard to take them orally, for 3 to 5 days in the hospital to help the symptoms go away faster. It is not 100% proven that it helps to those symptoms to improve more, but they help the improvements to be faster. So most of the MS patients, at least initially when they are diagnosed, are in this category of relapsing remitting. So with the medications in MS, we mainly try to treat this relapsing remitting phase by trying to reduce the new relapses, the new clinical events, and new spots that are gonna be produced in the MRI. Um, but sometimes some patients who have been in relapsing remitting phase for a long time, at some point starts having something called secondary progressive phase. So that secondary progressive phase is a phase that you don't develop any new symptoms suddenly, because the relapses, if you remember, I told you there are new symptoms that last more than 24 hours and they are like relatively quick in onset. So they're acute, they're quick in onset. Okay, which day they happen, or like within which 2, 3 days they started happening and they got worse. When you are in secondary progressive phase, you don't know when the things started. You know that like you are slowly getting weaker. You cannot walk as much as you were walking before. For example, if you used to walk 2 miles a day, now you walk like a half a mile and you need to sit down and you cannot continue. You might have more balance problem. You might have like more weakness in your legs, and or you might have more cognition problems. The problem is that you don't know when this is started. It just goes very slowly and smoothly and progress to the worsening. So, and then there is another type of disease from the onset get-go, which is called primary progressive. These patients, they have spots similar to MS patients in their brain, but and they have neurological symptoms, but similar to secondary progressive, after the time of progression started from the beginning, they don't know when the disease starts. They don't know when the symptoms starts. For example, if they're gonna have leg weakness, they are slowly gonna feel that I'm walking less. There is no single day or week that the symptoms started. When they want to pinpoint to you when that symptom started, they cannot really say. They say, okay, maybe for the past couple of years, I've been starting like getting more problem with my balance. I'm getting more falls. I cannot walk as much as before, and there is no like other explanation for this problem. So there is no back problem. There is no heart problem. So there is no other problems that I can explain it. And then when they get the MRI, they see the spots of MS in their brain. So that is called primary progressive. Unfortunately, almost all of our medication mostly treat the relapsing remitting, and they have lower efficacy in treating the secondary progressive and primary progressive stages. But I promise you, there is lots of research going on, and I'm pretty sure soon we are going to have lots of new drugs. Like up till 10, 15 years ago, even for relapsing remitting disease, there were only few options of medication with lots of side effects. But nowadays we have lots of different good medications with tolerable or not no side effect for most of the people, who do a very good job in reducing those relapses. So again, if you want to say it like with this diagram, benign MS is a type of MS which is like has very low number of relapse. It's relapsing remitting, but it has a very low number of relapse. And even if you don't treat them, sometimes these patients are missed to be diagnosed for several years because something happened, like maybe in their 20s, that they really didn't take, it wasn't that important for them. And then in their 30s, something else happens. So, like, it took them 10 years without any medication to have a new attack. So, these are the MS patients. They really return to normal after each attack, and there is not much of the relapses. Then there is a regular relapsing remitting problem. Regularly in relapsing remitting, as I say, they almost get back to normal, but there are some levels of disability that can be remaining. Especially, which is like the things that is most commonly experienced, is that if even the patient feels that I'm 100% back to normal or 95% back to normal, whenever they are feeling sicker, like they are having a flu, they're having common cold, urinary tract infection, having like a too much stress, like they are stressed out, they're fatigued because of too much exercise, their body temperature is high because of the fevers, or because of like just too much exercise, the symptoms they had with the prior attack become more noticeable for a little while. So it doesn't mean the disease is active again. It just means that we call this a pseudo relapse, when the symptoms that you had before with your MS relapses come back when you are sicker for any reasons. Usually happens a lot when it's like a very hot weather. Lots of MS patients are very heat sensitive. So when they are heat sensitive, taking a hot shower, using a sauna, jacuzzi, like doing too much exercise that causes increase in the temperature, or having fever causes those symptoms more. It doesn't mean that they have to avoid those things. Like, for example, exercise is a great thing for MS. You should not avoid it. If you do an exercise, your body gets hot, your symptoms get worse, don't worry, your disease is not more active. This is gonna go back to normal when your body temperature goes down and you get a little bit more relaxed and rested. Again, secondary progressive, you see it here. There is each attack similar to relapsing remitting, but just at some point they start having some progression. One thing that we definitely need to stop is these relapses, because with each relapse, usually there is a little bit of disability coming. Um, and not most of the patient, not all of the patient are in the benign phase. And the second is that to try to stop the progression. As I said again, so far we are not much successful in stopping the progression of the disease, but there are lots of great MS medication that has reduced the number of the attacks. And the primary progressive MS is just a progression of the disability without knowing when they started. So, again, diagnosis is very hard for MS patients. There are like criterias that I'm going to talk about it in a different video, that how we diagnose MS. But technically, there are things that we have to establish, is that there is no other disease that explain these symptoms. There is different times of clinical symptoms, or your brain MRI, brain and neck and thoracic MRI shows disease activity in different part of the central nervous system in different timing. So we have to find out that there are different timing that the inflammation existed, and inflammation has to be spread throughout the brain and spinal cord. If it's in only one focus, we cannot diagnose with the people with MS. They can go back to the CIS category, the clinically isolated syndrome category. Sometimes, again, when I'm talking, and I'm going to talk about clinical criteria for diagnosing FMS, I'm going to explain it more. Sometimes, especially for establishing the chronicity of the time of inflammation, we need to do a lumbar puncture and get the spinal fluid. And MRIs are definitely needed for the diagnosis. Sometimes the spinal fluid is also needed to check for other type of MS mimickers, other autoimmune diseases that can mimic MS. Sorry. So is the MS fatal? So the life expectancy of the MS patient, it used to be a little bit more reduced comparing to general population, but nowadays there is a little bit less, but not like a hugely different because there are so many advances in finding in MS medications and also trying to treat other problems. So MS itself usually doesn't kill anyone. As I say, usually because they're very rare circumstances. It's usually like because of other problems like urinary tract infections or the immune system being like kind of compromised because of the medication that the people get and getting them in other infections. So it is very important to treat any sort of infection that happens in MS patients, especially because most of them are immunocompromised because of the medications that they are taking. So am I gonna be like wheelchair bounded? Most likely not. Most of the people are gonna be able to walk and they're not gonna be wheelchair bounded. Some of them even might have like need a little bit when they get older, they might need some assistance with like a cane or walker. But most of the people are good with the physical therapy, with helping to reduce the attack that doesn't even cause them any problem of weakness in the legs. Most of the people are gonna stay fine and be able to walk. So if you got a diagnosis of MS, don't think that you're gonna be paralyzed, you're gonna be wheelchair bounded. The chances are you're not. So again, we talked about relapses. So what are the relapses? The relapses, again, is a symptoms that last about 24 hours, more than 24 hours, without any triggers. And there should be new symptoms or progression of the prior symptoms. For example, if you had a numbness in the hand and it was up to here, but then you started having the same numbness, but it spread up, it could be a new relapse. So it could be the progression of the prior problems, or it could be a new problem. So again, when this new thing happened, definitely tell your neurologist. If the symptoms is very bad and bothering, definitely go to an emergency room, and they would give you lots of time depending on the situation. Sometimes they have to first make sure that there is no infection going on, so they might run some tests, but then eventually they might give you like IV steroids. I told you the IV steroids are helpful to shortening the time of the relapse. They most likely will help that you accomplish the remission and improvement of the symptoms more, but there is no 100% evidence that the steroids is gonna help you achieve that, but it has definitely shown that it shortens the time of the relapse. So again, going back to what we were talking, um, sorry, let me stop the share here. Okay. So going back to what we talked, so MS is an autoimmune disease of the central nervous system. Usually, it comes in waxing and waning of symptoms. There's usually a new relapse, which is a new attack of the disease every now and then, with a new neurological symptoms that we cannot have any other explanation for it. The symptoms last more than 24 hours, and a new relapse is a symptom that is new or a progression of the prior symptoms. If you're experiencing a symptoms that you had experienced before, it usually happens during the sickness or like being so much stressed out. It is likely that it's a pseudo relapse. And again, there are lots of medications now in the market that we're gonna explain about them. Like I'm gonna definitely have a video, I promise, to talk about different medication, what are the efficacy and what are the side effects, and then you can talk about it to your doctor to see which one of those medication is more suitable for you. So depending on the side effect or how active your disease are, and that your doctor might help you to choose between those medications. So stay tuned. I'll try to get more videos about how we diagnose MS in more details. And I'm gonna try to make a video for you about like MS medications. If you had any other questions, leave it in the comment area, and I'll try to assess it. Maybe one day I'll just get a video and answer all the questions in there as well. Again, it would be very helpful for me and other people if you subscribe and like the video. It would help the spreading this video so other people would be seeing it and it would be more discoverable in the YouTube channel. Hope that I see you soon again, and I hope you have a wonderful day and week and life ahead of you. Bye.